Hi, everyone. This is our case conceptualization and treatment plan presentation with the five of us, and we're about to get started. All right, so for the case history, Shrek is an adult ogre who lives alone, and he is unemployed, living in a swamp. He is often accompanied by his sole companion, Donkey. His chief complaint is he sought treatment after being kicked out of his home on his seventh birthday and rapidly became an adult afterwards. As he wandered the countryside looking for a swamp to call home, he noticed that he was having extreme anger issues. When he would interact with people, they would often be rude to him, and he would respond by roaring and yelling at them, and then he would chase them away. He does want to live alone without any interaction with others. After finding a swamp to call home, he found that these angry feelings are not going away. The history of the present illness, he said that his angry behavior and outbursts date back several months to when he first was sent away from home, or several years, I'm sorry, when he was sent away from home by his parents. He stated that his anger at other people goes back to his childhood, even before his sudden transition to being an adult. However, the same feelings have persisted in adulthood. He reports that he experiences outbursts at people about 2 to 3 times a week, and he says that he cannot interact with people at all without yelling at them or threatening them. His emotional symptoms include a desire to be alone and anger. His cognitive symptoms include feeling that he is being judged and thoughts that he would be better off by himself. His behavioral symptoms include yelling or roaring at others and threatening them until they leave. And his physiological symptoms include dry mouth, increased heart rate, blood pressure, and shaking. Next slide, please. Alrighty, for the mental status exam. For past psychiatric history, he has sought counseling from a therapist on one occasion who reacted with fear to him being in the therapist's office. However, the therapist did try to teach mindfulness meditation to Shrek, which failed as Shrek felt that he was not making any progress. Personal and social history. Shrek was abandoned by his parents at the age of 7, being told it was an ogre tradition to send their child out to seek solitude. Shrek was largely ignored or feared by other people after this and often yelled at him and threw objects at him. He received only one act of kindness during this time, a friendly wave from a princess. Shrek's vulnerability was covered by a defense mechanism of negativity and threatening people that he encountered. The only individual to see past Shrek's anger is his companion, Donkey, who has urged Shrek to seek help. Medical history. Shrek has sought care for high blood pressure, and he was diagnosed with hypertension by his primary care provider. However, Shrek is not adherent to his medication regimen. For the mental status observations, he was fully oriented with an irate mood. He appeared disheveled and often raised his voice or rolled his eyes when answering questions. And for the ICD-10 diagnosis, he was diagnosed with antisocial personality disorder, F60.2.
All right. With my part, I initially thought the same thing in regards to the antisocial personality disorder when in the very beginning of the film. But then as the film began to progress and other aspects of his personality and his feelings began to come out, I started to notice that it could have been avoidant personality disorder just overall. And it's a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation that begins in early adulthood and is present in a variety of contexts. And some of the criteria is unwilling to get involved with people unless certain that they're going to be liked, avoids occupational activities, but he doesn't have a job, but he avoids situational, relational, any form of relationships, that involve significant interpersonal contact because of fears of criticism, disapproval, or rejection. He views self as socially inept, personally unappealing, or inferior to others, and is preoccupied with being criticized or rejected in social situations. He more or less accepts the fact that he's going to be rejected. So it's like, I'm just going to reject you first before you do it to me.
Mm-hmm.
And so some of the observable patterns to justify the personality disorder, his hypersensitivity to negative evaluation, and the example would be Shrek's reactions to being judged. And it's by the villagers of Fiona's initial disgust supports this. His social isolation, Shrek lived alone in a swamp and initially prefers solitude, avoiding others and expressing discomfort with social intrusion. Hidden sensitivity. Despite his tough exterior, Shrek has insecurities about being an ogre and a desire for acceptance, which becomes clearer as the story begins to progress. He also had a persistent underlying desire for connection, but does not believe in the possibility of obtaining it for himself due to his inadequacies based on how other people respond to him. And because of all of that, he created this element of self-sufficiency. Shrek values his independence and his privacy, often rejecting help and companionship. And the thing that I highlighted was the extreme display of anger and aggression may appear to reflect antisocial traits, but may not necessarily be personality disorder. And then that took me into another aspect, which was the provisional diagnosis, which was adjustment disorder with that's unspecified, which and chronic. And the reason why I said this was because it's significant emotional and behavioral symptoms due to identifiable stressors, which is the rejection of others, the rejection from parents and having to be alone, and nobody wanted to be around him because they were afraid of him. And so his response to that stress was anger and aggression. Stress related to disturbance does not necessarily meet the criteria for another mental disorder and is not merely an exacerbation of a pre existing mental disorder. So it may not necessarily be holistically, what is it, antisocial personality, because of some of the other aspects that are tied to antisocial personality. It's violating the rights of others, disregarding the law. Um, there were other elements. I can't remember them all off the top of my head, but definitely violating the rights of others. He was more just concerned about leave me alone and I don't want to be bothered with you. Once the stressor or its consequences have been terminated, which you begin to see towards the end of the film, the symptoms do not persist for more than an additional 6 months because he ends up professing his love to Fiona. And if he really did have a, a personality disorder, maladjustment wise, that's kind of rigid, he wouldn't have been able to profess that to her. And the disorder that I ruled out was schizoid personality disorder. And that is a pervasive pattern of detachment from social relationships and a restricted range of expression of emotions in interpersonal settings. And the reason why I really put this one down is because it wasn't like he didn't have emotions. When you deal with someone who has schizoid personality, there's no reaction to anything whatsoever. It's like they don't really care much about anything. They lack close friends or confidants other than their first degree relatives, but he didn't have any. He doesn't take pleasure in few activities or anything at all, which kind of isn't true because you could see, I mean, even though it was nasty, he enjoyed taking a shower in mud and farting in the pool. You know what I'm saying? It was stuff like that he enjoyed doing. He neither desires nor enjoys close relationships, including being part of a family. The reason why that's the part that caused me to rule this out, because when you start looking at how he starts interacting with Donkey and interacting with Fiona, you can see that he actually had a desire to connect. That desire was authentically present, so that automatically rules this out. He almost always chose solitary activities, but that's because he would rather avoid the rejection and the fear of other people. Showed emotional coldness and detachment or flattened affectivity. I wouldn't say that he had a flattened affect. It was more anger and retaliation towards other people. And so with this disorder, there's no real underlying concern about rejection or the opinions of others. So this will kind of veer towards like antisocial personality disorder, because they generally don't care about how you think about them and how you feel. That this would take part more in violating the rights of others, even though that's not present, but you would see that. All right.
For the case formulation, some of his precipitants were that like his history of being treated badly without respect or with fear by other people. And you know, we see this immediately at the start of the film where he's being hunted by I don't think they're killers, but they're hunting him down to add him to the thing for Lord Farquaad. And that also ties in with the next point, people frequently trying to kill him and stuff like that, which definitely doesn't help in his case. Not to mention the being abandoned by his parents so young. He's judged based on his appearance, and people often react with like the fear and the things that I mentioned earlier. For the longitudinal view of this case, overall, like since the beginning of his problems, he's isolated himself to a swamp, which doesn't give him a lot of opportunity to reach. Like it sort of reinforces his not reaching out and believing that others won't. He like not wanting to get close to others because he's in a swamp by himself. He doesn't really run into very many people except for people who are hunting him down, which is not great for friendship purposes. So that reinforces him not trying to get close to people. He either scares them off for his own safety or he avoids them. For example, when he first runs into Donkey, he just keeps walking away and like even like pushes him away at certain points. Um, he also helped. Yeah, he's also developed this world versus him perspective where he believes he's better off alone, and you can really see it throughout the film as he like talks about himself and how people like how he interacts with people and how they interact with him. For the cross-sectional view of like just in the perspective of the film, he has a very cynical view of fairy tales, especially in the first scene we see him in where he wipes his butt with a fairy tale book. Um, and he jumps through hoops having to avoid having to be around anybody else, like in the Donkey scene where he first meets Donkey. Um, and he just like I said, he's just ignoring him for as long as possible. When ignoring him's not working, then he starts like pushing him away and things like that. He struggles to accept that others don't immediately hate them, like in the Donkey scene. um Donkey gives him a compliment and he's like stunned getting the compliment. And he also struggles to accept that he could be loved too. When he's starting to develop the relationship with Fiona, you can really see that he's like struggling to think that like could this be really happening to him, especially from everything that he's already like previously experienced and stuff. In terms of his strengths and assets, he's very independent and self-reliant. We see, and I'm going to also tie in that he's also a proficient cook and forager. Because we see early on in the film that he has to do a lot of things by himself because he lives alone in the swamp. So he makes his own signs, he makes his own dinner, he finds his own dinner and then he makes it. And he gets really creative with doing that too, which is another strength of his. Like he knows how to cook rats a different way and like make all kinds of stews and uses eyeballs for toast and things like that. And I think those are good strengths because they become like points of connection for him, if that makes sense, because he bonds with Fiona over like his being able to cook and things like that. Another strength is that he's able to protect himself without hurting others, which I think ties in with why antisocial personality disorder doesn't fit him, because when the people are trying to hunt him down and stuff, he doesn't hurt them. He just scares them away so that they will leave him alone. And I think that reflects a certain like strength of character and such, because he could hurt them. It's not like he would be like unjustified in doing so, but he chooses not to. And that's about it for something.
Okay, so in this section, I'm going to summarize the working hypothesis that I formulated to understand Shrek's case presentation and how it connects to the diagnosis and how it can be used to inform treatment. So the core idea is that Shrek's anger and isolation are protective strategies. So he's using that like to defend himself. Somehow his body learned that, well, this is um the best way I can protect myself is not allowing others to come into my circle. So I'm just gonna keep them away. And he developed this from a long held belief that he is unlovable and that he is dangerous. These beliefs likely developed from being abandoned by his parents and repeatedly rejected by society and even hunted. So this is not just like rejection. Also, it's like people see him with a disdain just because he's an ogre. So all these things contribute to how he developed these maladaptive coping skills. And so, yeah, and like Vanetta was saying, these issues have led him to push others away before they can hurt him. So in a way, he just doesn't even want to let people approach him. It's like, I know exactly what's going to happen. You're going to hurt me, so I'm just going to push you away before that even begins. Using the cognitive model, we can analyze Shrek's core belief. Basically, yes, I am unlovable and I'm dangerous. That's his main belief. Um, and we can connect this to the automatic thoughts that he experiences in social situations. The primary automatic thought here is people will always reject me, so it's better to push others away first um, before they get close. These thoughts lead him to this defensive behaviors like roaring at others or retreating into his swamp. So then he stays socially isolated. And these issues reinforce his sense of isolation and they also confirm his fears. So, in a way, it's like a vicious circle. It's what some of us may call a self fulfilling prophecy, where it's like people are going to reject me, but he's also contributing to that rejection because he isolates himself from everyone. So, it confirms his beliefs. So then he can have that, aha, you see, that's exactly what's going to happen. They're going to reject me, but he also puts himself in a situation where he's not approachable. So this cycle works in a way that maintains the dysfunctional lifestyle. So because he, in a way, has his beliefs reinforced, he feels validated in maintaining that cycle. And so it's really difficult to break out of that pattern of dysfunction. So the connection to diagnosis, which was avoidant personality disorder, um, I can see a preoccupation with rejection and criticism, social inhibition and hypersensitivity to being evaluated, and he sees himself as socially unappealing or like less than or inferior because he's an ogre. So this conceptualization supports the diagnosis in that his avoidance of social interactions, like hypersensitivity to criticism, and also his negative self-perception, these align with the diagnostic criteria. And while he seems aggressive on the surface, his behavior tells us that he has a fear of being hurt. He just doesn't even want to deal with the possibility of somebody approaching him and then finding out how he really is or who he really is and rejecting him. And in a way, he's also learned to see himself as as others see him, especially like his parents. While he feels rejected when he was a child, and he believes, well, I'm going to be rejected. That's just what people do, and I should. In a way, he kind of like sees it as like this is how it should be. People don't want to be close to ogres, so he sees it that way, unfortunately. Um, So a great example of this is he actually wants a connection with Fiona, but he believes that that's not possible for somebody like him. And as the movie progresses, we can see that eventually he opens up and then he ends up having a great relationship with Fiona despite how others perceive him and despite his own character and all of that. So the treatment implications or like how these can help the interventions. Basically, they can help with identifying and restructuring maladaptive beliefs. They can help encourage safe social interactions without like verbal abuse, without yelling, without anything like that. And they can help build confidence in forming new connections. So through the CBT lens, a CBT informed treatment plan would involve Shrek, well, helping him recognize and challenge his automatic thoughts and cognitive distortions. And the interventions could include cognitive restructuring and gradual exposure to positive social interactions. And over time, the goal is to help him form healthier relationship and develop a more realistic and empathetic view of himself so that he's not like beating himself down in a way, because he looks like he's proud to be the way he is, but in reality, he's beating himself down over it.
Okay, so for the treatment plan, I gave him some long-term goals and some short-term goals. So, but for the behavioral definition, we're looking at his sensitivity to the criticism or disapproval of others. He has that increased heart rate, sweating, dry mouth, muscle tension, and shakiness in social situations. I gave him three long-term goals, which is to enhance his interpersonal skills to build connections that reinforce recovery system, achieve equilibrium between solitude and social interaction to support emotional well-being, participate in interpersonal situations without experiencing excessive fear or anxiety. His short-term goals would be to examine how his past experiences and psychological factors have shaped patterns of social apprehension and withdrawal, and to take part in acceptance and mindfulness-based interventions to reduce symptoms of social anxiety. So those therapeutic interventions are to assess the client's history or Shrek's history of social anxiety and avoidance, including frequency, intensity, and duration of anxiety symptoms, triggers, and the nature and extent of avoidance. So we are going to be using the oh my gosh, I just totally blanked out. The commitment theory. Could somebody help me with the A? I forgot what the A is.
Acceptance.
Acceptance. Thank you. Acceptance, and commitment theory and mindfulness-based stress reduction. And we are also going to be using some CBT as well. Just to kind of help him accept and openly experience anxious thoughts and feelings without being overly impacted by them, shifting focus and committing time and efforts to activities that are consistent with identified and personally meaningful values. Okay, so the course of treatment, is so for his treatment modalities, we're going to do individual psychotherapy using the cognitive behavioral therapy, acceptance and commitment therapy, and mindfulness-based stress reduction. We are looking at 50-minute sessions for 12 weeks, with possibly extending it based on his progress. We're going to focus on reducing symptoms of social anxiety and avoidance, enhancing his interpersonal functioning, building tolerance for emotional discomfort, strengthening values based living. And then, so supportive strategies, we're going to make sure we're taking a look at his psychotropic medication management, making sure he's underneath that psychiatric supervision, and any testing, psychological testing as needed for any diagnostic clarity. And then we're just going to measure his progress through standardized assessment tools, self-report inventories, and clinical observations. So the cognitive restructuring, the cognitive behavioral therapy would be like the cognitive restructuring, identifying and challenging his distorted thoughts. With the ACT, we're going to use focus, where we're going to increase his psychological flexibility and values-driven behavior, and diffuse from thoughts like I'm unlovable, using mindfulness and self-talk reframing, with which will help Shrek accept anxious feelings and engage meaningfully with others. And with the mindfulness-based stress reduction, we're going to do some deep breathing before social situations to teach Shrek to pause and take slow, deep breaths before interacting with others, especially when he's feeling judged or anxious around the villagers.
And here we have some video clips about him basically displaying some of the behaviors we've been talking about throughout the presentation.
And that one, that's Throwback, the only ogre to ever spit over 3 wheat fields.
Right. Yeah. Hey, can you tell my future from these stars?
Well, the stars don't tell the future, Donkey. They tell stories. Look, there's Bloodnut, the flatulent. You can guess what he's famous for.
All right, now I know you're making this up.
No, look. There he is, and there's the group of hunters running away from his stench.
Man, that ain't nothing but a bunch of little dots.
You know, Donkey, sometimes things are more than they appear. Forget it.
Hey, Shrek, what we gonna do when we get out of swamp anyway?
Our swamp?
You know, when we through rescuing the princess and all that stuff.
We? Donkey, there's no we. There's no our. There's just me and my swamp. And the first thing I'm gonna do is build a 10-foot wall around my land.
You cut me deep, Shrek. You cut me real deep just now. Hey, you know what I think? I think this whole wall thing is just a way to keep somebody out.
No. Do you think?
Are you hiding something?
Never mind, Donkey.
Oh, this is another one of those onion things, isn't it?
No, this is one of those drop it and leave it alone things.
Well, why don't you want to talk about it?
Why do you want to talk about it?
Well, why are you blocking?
I'm not blocking.
Oh, yes, you are.
Donkey, I'm warning you.
Who you trying to keep out? Just tell me that, Shrek. Who?
Everyone, okay?
Oh, now we're getting somewhere.
Oh, for the love of Pete.
Hey, what's your problem, Shrek? What you got against the whole world anyway, huh?
Look, I'm not the one with the problem, okay? It's the world that seems to have a problem with me. People take one look at me and go, ah, help, run! A big, stupid, ugly ogre. They judge me before they even know me. That's why I'm better off alone.
You know what? When we met, I didn't think you was just a big, stupid, ugly ogre.
Yeah, I know.
So, are there any donkeys up there?
Well, there's, Gabby. The small and annoying.
Okay, I see it now. Yeah, the big shiny one right there, right? That one there?
That's the moon.
Oh, okay.
And here is another one.
Oh, no. No! What are you doing in my swamp? All right, get out of here, all of you, move it! Come on, let's go! Hapaya! Hey!
Come on,
No, not there! Not there!
Hey, don't look at me. I didn't invite them.
Oh gosh, no one invited us.
What?
We were forced to come here.
By who?
Lord Farquaad. He hoofed and he puffed and he signed an eviction notice.
All right. Who knows where this Farquaad guy is?
Oh, I do. I know where he is.
Does anyone else know where to find him? Anyone at all?
Me!
Anyone?
Oh, pick me! Oh, I know, me!
Okay, fine. Attention all fairy tale things. Do not get comfortable. Your welcome is officially worn out. In fact, I'm gonna see this guy Farquaad right now and get you all off my land and back where you came from. Oh! Yeah. You're coming with me.
All right, that's what I like to hear, man. Shrek and Duncan, two stalwart friends off on a whirlwind big city adventure. I love it.
that was the end of our presentation. I hope you enjoyed it, and we all thank you very much for watching.